Have you been diagnosed with depression and struggle with sadness?
Maybe you're scared of being criticized.
Loss of interest, aches and pain.
Always thinking something terrible.
Ask your doctor about Effects or Exile.
Ask your doctor about Cymbalta.
Talk to your doctor about
So
Zoloft.
talk to your healthcare professional.
Get your doctor
Talk to
today.
your doctor.
Tell your doctor.
Contact your doctor immediately.
Talk with your doctor.
Over 40 years ago, leading psychiatrists met in Puerto Rico to map out their vision of the future.
We see a developing potential for nearly a total control of human emotional status, mental functioning, and will to act.
Their plan? To create by the year 2000 a range of psychiatric drugs regulating every aspect of human behavior.
I was diagnosed with depression and put on Paxil.
ADD, and I was prescribed Ritalin.
General anxiety disorder, prescribed Zoloft.
Bipolar disorder, and I take lithium.
PTSD, Zoloft.
I was on Paxil.
When they placed me on Zoloft.
They gave me Adderall.
I was prescribed Siptamu,
Tegretol,
Lexapro, Depakote,
Stelazine,
Adderall,
Concerta, Orzine,
Prozac,
Lorazepam,
Effexor,
clonazepam,
Ritalin,
dexamphetamine,
Paxil,
Cylert,
Prozac,
Adderall,
Elavil,
Depakote, Wellbutrin, Seroquel, etc., etc.
100 million people worldwide are on psychiatric drugs. How did this happen? Psychiatrists convinced them they were sick.
They want you to think you're diseased from birth, and that all those experiences of life, childhood and adolescence and teenage years and adulthood and being a senior citizen, that these are all various stages of disease.
Because let's face it, we've all been depressed at one time. We've all been anxious at one time. These are normal emotions that we feel.
Every emotional and spiritual problem is reduced to a label.
And of course, all of those diseases require pharmaceutical treatments. This is big, big business.
While generating a healthy income, claiming to be medical professionals, psychiatrists will freely confess that their profession is devoid of science.
We don't really have any specific blood tests or other tests that are definitive for any mental illness whatsoever.
It would be neat if it would become much more scientific.
If you go to my office and you tell me that you're depressed, there's nothing, no blood sample, whatever, no tests.
There are not current available tests to verify your diagnosis.
I don't use any tests.
You do not have a test to say, well, this is this disorder and this is the best medication for this disorder.
For many years we thought we had the tests nailed down, but it turned out that they weren't of any value.
If you don't know what's causing the symptoms, then to give somebody something to alleviate the symptoms is close to impossible.
By the time a drug's approved and it hits the general population, we don't know even 50% of the side effects that are involved with that drug.
And these pills cause heart attacks and liver problems and immune system problems and lots of other medical problems. So you're playing with fire.
Every day, psychotropic drugs cause serious adverse reactions. And while psychiatrists and drug companies fully understand the dangers of the drugs they sell, their unsuspecting customers are left to suffer the consequences.
I'm 10 years old. I'm going to read, I think, the side effects of a drug called Daytriana.
The drug Adderall. Luvox, Cymbalta,
Gyudon, Lexapro,
Namenda.
I have a question.
Where do I find the side effects?
How do I read it if it's so small?
Just a bunch of letters squished together. I can't read this. This is the side effects of the drug.
Side effects. Stroke.
What the heck?
Speech disorder.
Eye disorders, vision blurred.
Dry mouth. Nervous.
Tremor, dizziness, delirium, and coma.
Tardive dyskinesia.
They experience worsening of their depression.
Aggressive reaction.
Paranoid reaction. Psychosis.
Serious cardiovascular events.
Other serious heart problems.
Heart failure.
What? Suicidal thoughts. Suicidal thinking and behavior.
Increases the risk of suicide. An increased risk of death. Sudden death. These guys must be kidding. Wow.
This is gross.
Seeing this on a warning label, does anybody have any clue what they're putting their kids into?
This isn't good.
Side effect is just a way that doctors explain away the effects that they don't like or you won't like.
but their effects.
These are the effects of these drugs. They're not just what might happen to you, they're what happen more often than not.
We name them side effects because they're they're an unintended consequence.
The antidepressant drugs not only don't make you happy, they have all kinds of negative effects on the system as a whole.
These drugs are absorbed and distributed throughout your entire body, so they have side effects through all of your tissues and organs, including your liver and your kidneys and your nervous system.
They destroy the brain, the neural net. They literally kill brain cells and cause all kinds of brain disorders. That's why we have they're not side effects, they're direct effects.
But while psychiatrists continually downplay the multitude of severe health risks to the public, candidly, they had no problem admitting them to our cameras.
I think I tell them the main side effects. I don't tell them every side effect because there's so many possible side effects.
I would say the majority of patients experience some side effects.
People get side effects to every medication you try.
They all have side effects.
All kinds of side effects. Lots of side effects. Physical feelings of sickness.
Headaches, insomnia.
They can't sleep. They can't eat.
Drowsiness.
Sedation is very frequent.
Restlessness, appetite stimulation,
neurologic side effects,
tremor or muscle spasms,
stiffness, weight gain,
obesity,
weight gain and stuff like that,
decreased performance of sexual functioning, sexual side effects can happen,
sexual dysfunction, etc.
I've never had anybody die or anything, but I've had people faint and stuff, and it's really sort of unpredictable.
You name it, and it can be a side effect.
And why can't psychiatrists predict what adverse reactions you will get? Because not one of them knows how their drugs work.
At least with street drugs, people know that they're dangerous, that they should be off of them. With pharmaceuticals, people are told they're safe to take every day.
But far from being safe, psychotropic drugs are increasingly being exposed as chemical toxins with the power to kill.
Some of the side effects that have become of concern lately are suicide, increased risk of suicide, increased risk of homicide.
These aren't people that were horribly depressed when they were given a drug. These are people who are given a drug for social anxiety or difficulty sleeping or mild depression and then become suicidal. And so when they become suicidal and they kill themselves, what the doctor does is go back and say, oh, well, it's because they were depressed.
The label itself, the disorder, is what is blamed for the side effects, when in reality, it's the drug that is causing the side effect. It is the drug that is the problem.
Drugs such as the antidepressant prescribed to Woody Witzak, who took it not for any mental complaint, but to help him sleep.
My husband and I, Tim, his nickname Woody, we were married just 2 months shy of 10 years, so we've had a long life together. And Woody was a guy who was healthy. He was a big runner. He's never had a history of depression or any other so-called mental illness. He was given Zoloft for insomnia. I find Woody one night completely sweat through his shirt in fetal position, kept going, Kim, you gotta help me, I don't know what's happening to me. It's like my head's outside my body looking in. Kim, help me, help me. We did breathing, listened to music, prayed, anything to calm him down from this head outside his body feeling. And a week later, he was found dead hanging. A guy who loved life.
Psychiatrists claim their drugs save lives, but according to their own studies, psychotropic drugs double the risk of suicide, with one increasing the risk by a factor of almost 7.
As a pharmacist who has been studying the problem for the past 7 years, I do see a glaring connection between the high use of these psychoactive substances and the rise of violence.
If people knew that the mechanism was not known of these drugs, that they could cause, if there's a real chance for them to get a homicidal tendency or even suicide, if you take the drug, there's a chance you may want to kill yourself.
And I could repeat probably a dozen other examples of significant self-inflicted harm or significant violence to others in patients who had never had that experience in their adult life.
And as psychiatrists spread their lucrative game of psychotropic drugging further and further into society, children have become the latest and most tragic of casualties.
Rebecca Riley, 2.5 years old, they diagnosed her with bipolar disorder and ADHD. They had her on an antipsychotic, they had her on a heart drug, they say, for ADHD, and they had her on an anti-seizure. And then one other one for side effects. 4 drugs at 2.5 years old. She can't even zip up her own pants. She's like a little rag doll. The school nurse, 2 teachers, the principal, the social worker, all said they never seen any behavior in this little 4-year-old girl that would warrant these kind of medications. And all specifically called this doctor and said, please take her off these. She died at a little over 4 years old. This little girl that didn't have a chance, and the psychiatrist just let her.
Instead of standing trial and facing prison time, Rebecca Riley's psychiatrist, Dr. Keiko Kifuji, hasn't even lost her license. One might well ask how psychiatrists get away with it. The answer lies in a legal concept known as standard of care.
The standard of care is based on what do other doctors do? What would a reasonable physician do in this situation? And the reality is that what most physicians do is prescribe medications.
As long as they've done their paperwork properly and documented that this child had the symptoms that led them to this conclusion, they appear to be completely protected from any kind of a lawsuit as a result.
The standard of care is what allows doctors to seriously injure or even kill a patient with total impunity.
So the standard of care now has been implemented to where you can get away with, if you're a medical doctor, psychiatrist, you can get away with murder.
And the death count keeps rising. Psychotropic drugs now kill an estimated 42,000 people every year.
The cost to society is very real and very devastating. But the medicine they're practicing isn't real. It's a hoax.
Profit always comes before patient safety, and they take a very short-sighted view. It's all about how can we make money today, not what price are we going to pay tomorrow.
The trail of destruction that a psychiatrist leaves in his path is of no concern to that guy. It's all about money.
And the money is big. Psychiatry is today over a $300 billion industry without a single cure. And as more and more breakthroughs are promised by psychiatrists, their running total of sick, injured, and dead victims continues to escalate. Unprotected, it is the public, you, who must fend for themselves. But psychiatrists insist you believe that their drugs are safe and effective because they are the mental health experts and you are not. But case after case proves that trusting them can have disastrous consequences.
Psychiatry is pseudoscience. It's false science. It cannot withstand rigorous review if people would just look at the evidence.
If they help anyone, it's not worth the risk to the people that are harmed by them.
They are betraying every customer they have.
They don't know what they're doing, and we need to educate the public to use their feet and walk away.
Studies confirm that very little full and accurate information about psychiatric drugs is getting through to the public. So what would full and accurate, informed consent on psychiatric drugs consist of? These medical doctors and experts have extensive experience in the subject. Their first point: psychiatric disorders are not actual diseases requiring medical treatment.
It's true that there's no biological findings that really support any of these psychiatric diagnoses being medical illnesses. And the burden of proof really is the other way around. It's not that you have to prove that there is no biological science. The burden is on psychiatry to prove that there is.
There's no blood test. There's no lab test. There's no x-ray. These are just clusters of behavior that a group of psychiatrists have voted that it's a disease.
Can you imagine doctors having to have powwows to decide if a heart attack is a real disease or not? No, they don't have to decide that. They don't have to have a vote on that.
They should be asking the doc, geez doc, where's the chemical test for that? Where is the objective test for this? And I guarantee you that they'll be told,
We don't have a chemical test for that.
There is no such thing as a chemical imbalance. And any psychiatrist that you talk to, if you ask him this question, they'll all admit it in private, but they won't admit it in public. It's a scandal.
So this is all subjective. Nothing objective about psychiatry.
2. There is no scientific proof that psychotropic drugs resolve any mental problems.
Since there is no measurement for these psychiatric diagnoses, because they're really just subjective, for the same reason there really can't be a measurement for the effects of the drug.
In terms of medication, the evidence that's claimed is the medications are highly effective and not very toxic. But actually, in fact, the data in psychiatry are very clear that that's not true. What is true is that the medications are barely, if at all, more effective than placebo.
You're selling drugs to people under false premises, under a disease that's been invented. So how do you measure efficacy among a disease that doesn't even exist?
3. Psychotropic drugs mask symptoms and come with severe short and long-term side effects.
Whatever problem you're being treated for, whether it's depression, real or otherwise, or cardiovascular disease, medicating away the symptoms is not solving the problem.
The patent medication gives the appearance of having helped because in the short term, it usually doesn't show the bad effects that are going to happen in the long term. So it's very deceptive.
The longer the patient's on the medication, the worse the prognosis is.
None of these medications hit precise targets. You begin accumulating all kinds of collateral damage. In other words, other organs in the body are actually harmed.
So for the first time, we're seeing kids in grade school or middle school who have type 2 diabetes and who have the beginning stages of cardiovascular disease.
So you see Parkinson's disease, you see tardive dyskinesias, you see other movement disorders.
Is it true that we're now seeing a lot of death from psychiatric drugs? Absolutely yes.
4. Psychotropic drugs can cause dependency and addiction.
One of the hallmarks of informed consent with psychiatric meds is you have to discuss the potential for addiction.
The vast majority of psychiatric drugs create psychological and physical dependency.
Most patients that I've seen that were on these drugs have difficulty getting off of them. It's rare for somebody to just be able to stop it without a problem.
5. Most mental problems are caused by an underlying physical illness.
Many physical conditions can cause mental problems or what pose as psychiatric symptoms, but the psychiatrist, in the records I've reviewed, psychiatrist does not do an in-depth study of what could be causing the problem.
And if the doctor isn't taking the time to find the cause of those symptoms, then unfortunately those symptoms may continue and there may be a serious underlying medical disorder that's being overlooked.
The question is it better to treat depression with a drug, or is it better to treat depression by trying to figure out what caused the depression and working it out with the patient?
Dehydration can make you exhibit symptoms of depression. Sleeplessness can make you exhibit symptoms of depression. Eating a terrible diet, hypoglycemia, being sedentary, all of these things are biological reasons for having symptoms of depression.
I have in my practice children who are misdiagnosed as having ADD, ADHD, who really have Lyme disease.
70% of all what are classified as mental illnesses actually have a physical cause, a physical problem causing that.
6. No matter how severe the emotional or psychological distress, there are many effective options that do not involve psychotropic drugs.
Once you've proven that there is no problem in the body and that there is no malfunction in the brain, then you have to begin to address these other levels of the self. And I think that's what psychiatry has completely stopped doing.
There are very few conditions that cannot be treated by other methods than the use of drugs.
Any forces that impinge on medicine that make us think that the drug approach is the only approach is undermining good patient care.
And because most non-drug options are rarely told to patients, true informed consent is almost never given.
When you get into informed consent, it's almost a responsibility of the patient to
make an inquiry about the hazards of the drug and not rely on what the psychiatrist or physician tells them.
We can't go in and abdicate our responsibility as consumers simply because somebody has an MD after their name or someone is a psychiatrist and we think they know more than we do.
The best way to protect yourself is to educate yourself, is to ask questions not only of your doctor, but to do your own research.
Don't be ignorant, be informed. Get information from as many places as you can. That's how you'll be an intelligent, skeptical consumer, and that's how you will protect the safety of yourself, your children, and your entire family from this industry of death known as modern psychiatry.
And as modern psychiatry has permeated our world over the last 50 years, so too has psychotropic drugging.